If you often have lower back pain, it's essential that you start working on your deep abdominal belt. Because yes, we all have a belt made up mainly of abdominal muscles, which run from the spine in front of the abdominals to the other side. And the strength and stability of that belt have an impressive impact on pain and its prevention. In today's video, I'm going to show you 6 exercises so you can specifically work on that front part of the abdominal belt. And at the end of the video, I'll also refer you to another video where we'll work on the back part. In my view, you need to balance working the front and back perfectly so that your spine is like steel and you can face your daily activities without any kind of pain. To do these 6 exercises, you will need a pillow for your head and a hand towel that will help us keep the lumbar area in the correct position. You need to understand that these 6 exercises will progress from the simplest to the most difficult. We're not trying to create a routine, but rather to find the level of difficulty that works best for you so you can repeat it frequently. Perfect. Let's lie on our backs, place a cushion to make ourselves comfortable, and get into a relaxed position. Legs bent at about 90 degrees and a neutral position for the lower back. This is a very important point. When I talk about a neutral position for the lower back, this is what I mean. I don't want your back to be completely touching the floor so that you can't slide your hand underneath, but I also don't want you to be able to fit your whole arm through either. The midpoint between having your lower back completely flat against the floor and having it very arched, the midpoint between the two, that's the position we want to maintain throughout the entire exercise. And this is important because it will keep your back in a correct and protected position. I know that for many of you, it's hard at first to find that neutral position, and that's why we have the towel. We're going to fold it a couple of times and place it right there at the level of the lumbar area. It might cause a little discomfort at first, but I assure you it will help you work correctly. With my towel, I feel supported and confident my lumbar area won't flatten. We'll begin with level 1, my favorite, which is the foundation, deep abdominal breathing. I want you to uncover your belly in front of me. Touch it a little. I want you to place one hand on your chest, the other on your navel, and think about your breathing. Breathe in through your nose and let it out through your mouth, as if you were blowing out a candle. Now I want you to focus on the lower hand, so that when you breathe in, you feel how your abdomen inflates. Little by little, it becomes fuller. We breathe out through the mouth as if we were blowing out a candle. And now I want you to breathe in again, inflate your abdomen, and as you exhale, bring in your belly button. Pay close attention, as deep as possible, as if there were a hollow, as if you wanted to make your waist very narrow. And you will notice abdominal contraction in the front, a sensation as if you are pulling your abs. We keep the belly button down during the whole exhale. Obviously, it will depend on your level of abdominal fat whether it's more or less visible, but what you need to keep in mind are the sensations. We take a breath, inflate the lower hand, exhale, pull in the belly button, and notice how the abdomen goes in. I'm going to use the full camera so you can see it better. We take a breath, my belly inflates, we exhale, and notice how it goes in. We've done 4, let's do 6 more. This is something you need to practice, okay? It's not like you start doing it and it turns out well overnight. We release love. Very good. 5 more. Thank you. We release. Three left. Let's grab them. We release. Two. One. Very good. Relaxing and loose. During all upcoming exercises, think each time you exhale. Pulling in your belly button and sinking your abs is important, okay? That's level 0, the foundation we must master to work on the anterior abdominal wall. Let's start with the first exercise in the same position, so no need to adjust posture. Place your hands at your sides and pair your breathing with a leg raise. I breathe into my abdomen, and as I exhale, pay close attention. The tip of my foot points toward me. The leg rises until my femur is vertical, perpendicular to the floor. Pulling in your belly button, I breathe in. My heel touches down. I exhale and go with the opposite leg. 2, we're only going to do 10. That's 5 on each side. So you can see the example and try it at home to see if it's too demanding or not. Relax your belly buttons. Notice how my towel keeps my lower back neutral. Without it, lifting my leg would likely press that area down. 4. Exhale through your mouth as if blowing out a candle. Thank you. 5. We exhale. 6. We change cameras. We exhale. 7. We exhale. 8. Son, give us. 9. Come on, last repetition. Good, that's 10. What did you notice? Simple work, right? This is level 1. Almost anyone can do it, but it already involves quality work for the abs and hip flexors. Very good and interesting, suitable for everyone. It's helpful for lower back pain or improving your core. Second level, we're going to inhale, exhale, and lift both legs up. Here we can already see that the exercise is more complicated. You can adjust the difficulty just by thinking about your legs. Heels closer to your glutes, it's easier. Heels farther apart, careful, it's harder. So now you have a level of difficulty you can work with. Femurs vertical. We take a breath as always, let one leg drop, and once the heel touches the ground, exhale and go up. Now we're not just adding movement. The core has to keep the opposite leg up. Much more challenging, right? We take touch with the heel and up. If it's very, very difficult, we could always grab a knee and do the exercise with this level of difficulty. Okay. It would be a little harder than the previous one, but less effective than the pure difficulty. Come on, let's keep going. We're going to do 10. We've done 2. I touch down, and as you can see, my lower back is always pressed against the towel. 3. I touch down. 4. Each time I exhale, I focus on my belly button pulling in and the accompanying abdominal contraction. I touch. 6. I touch. 8. I touch 10, 24, 28. 9. I touch. 10. I bring my knees up with my hands. Wow, you've noticed the intensity here, right? We've made a significant jump in the difficulty of the exercise. We make small rocking movements, bringing the knees toward the chest. You can rest your feet on the floor and also do side-to-side rocking exercises to loosen up. As you can see, it already feels different and more demanding, with more work on the front and at the hip flexors. If during the exercise you notice any pain, if you can, just lower yourself and rest, or hold your knees to take a break. That was level 2. Now we're going to move on to level 3, which I'm sure some people won't be able to reach. We return to the starting position with legs at 90 degrees and femur vertical. Remember that if you lower your feet, it's easier, and from here we're going to inhale and exhale. I want you to fully extend your leg, knee straight, toes pointing toward me. This puts a lot of tension on your abdominal area. 1. And it makes the exercise more difficult. If you feel a lot of pain while doing it, especially psychiatric or back pain, stop. Obviously, this level isn't for you. You should do the previous level. 2. The more horizontal your lower leg, the harder it is. Don't let that leg go too high either, because then the lever arm will be shorter and the exercise will be easier. 3. And remember to breathe out as you do it. Let's switch the camera a little. 4. 4. Exhale. 6. Obligo. 7. 8. 9. And 10. We lift our knees. Small moves from Roy Ben. I've suffered, huh? You can probably tell how it's been more demanding, no doubt. It really increases the difficulty. But for me, it's been tough, huh? I admit it's been intense. Let's take a break. Ben's leg movement again, because this doesn't end here, okay? We've seen level 3. If this one was easy, you've done 10 reps without too much effort or pain. Next, we'll move to level 4, where we'll coordinate arms and legs together. Here it gets a little more complicated, so if you've only made it this far, you've already surpassed more than 90% of people. When it comes to abdominal strength, we return to normal breathing, we rest for a few moments. And let's go for it. The next one is called the dead bug. It's level 4 dead bug. We're going to get into the same position as before, and the arms are also going to participate. And now I want you, at the same time you stretch your leg, to lower the opposite arm to 45 degrees to form a V with your leg. We take a breath in the starting position, exhale, and switch to the opposite side. What do you think? Can you do 10 repetitions? Do them with me. If you can't, just watch. Let's go for it. Inhale, exhale, inhale, exhale. 1, 2, thank you. 4, 5, 6. Let's switch cameras. 7, 8, 9, 10, and 10. Wow, impressive. Breathe. Pull your knees toward your chest to relax and rest your legs. We rest. If this exercise is painful or too hard, we should stop and go back. In previous difficulties, pain often appears because we are facing activities that are too demanding for us, and our body needs to work even more at a lower level before we can keep climbing the ladder of intensity. Okay, great. This was level 4. Only level 5 remains, making 6 variations in total. Along with difficulty 0, which is absolutely the base, we take a breath, rest a bit before facing it. And as you can see, if you've been working with me, the towel represents a very important anchor point for your lower back, which we can't forget, since if it's not in a neutral position, the appearance of pain can be much more frequent. Perfect. The last challenge is the V, the pure V, which is going to challenge our entire anterior abdominal wall. We start from a position you already know, holding your knees and your hands together in a resting position. From here, we take a breath, and as we exhale, what we're going to do is stretch out our legs and arms as if we're forming a V, and like that for 10 repetitions, we take a breath. All right, let's start with the first one. Pointing your toes toward you is even better. 2, 3. 3, 3. 4. 5, let's go for it. Let's go. 6, 7, 8, 9, 10. Impressive work. My sincerest congratulations if you completed it with me. Also, remember to include deep abdominal breathing, even though it's easy to forget and hard to coordinate. When the difficulty increases, we catch our breath, move our legs a little left, right. And with this difficulty, we finish those 6 exercises to work the front wall of your abdominal belt. This part is just one of the pieces that make up the improvement in lower back pain. We also have to work on the posterior part, mobility and stability. It's like the 3 legs of a stool that you need to work on to build a steel back. And many times exercise fails because we do movements that are either too intense or not intense enough, which don't adapt to our abilities, or because we're not actually working. Those 3 legs are strength, mobility, and stability. If you want to learn much more about back pain, start getting into working on those areas. There is a very special event called Back Week, where for a very small amount you can enrich yourself, get to know your body and your pain much better, and have a clear direction on what you need to work on. To access it, simply click on the upper right corner of the screen to see what it offers and start your path to recovery. I'm also going to leave here, on the left side, the next video where you can also start working on strengthening the back of your spine. I hope you liked all of this, that you can practice it at home. It's extremely important that you stay consistent and keep it up, that you try it out and choose an exercise that works well for you. And we based our previous work on our abdominal belt on that single exercise. If it's level 3, for example, I invite you to do 3 to 4 sets of 10 to 20 repetitions of the exercise on alternate days to build a core and abdominal belt that you'll need to complement with posterior work, mobility work, and stability work. I hope you liked it, that you share it with those who need it, and that you come back to my channel in the future so we can keep exercising together. Bye, friends. God bless.